if you fuck up your teeth, like through an appliance, an oral appliance like AGA, that just pushes on the teeth, that does not ever heal. Once your teeth go down a path of destruction, they do not come back. It's a one-way path. You cannot really restore alveolar bone once you
Yeah.
have that resorbed through an oral appliance like AGA or some other expander. That's why I'm telling you, like, I didn't say, all right, Andriy, you have a few options. You have do nothing, you have double jaw surgery, or you can get an expander to push your teeth forward and get you a couple of millimeters that way. I did not say that because I do not think that's a good option. Leave your teeth alone because once they
Of
get fucked
course.
up, they stay messed up for forever after that. I know that because mine are like that. And we are live. Okay, Andrei. Am I saying your name right? Is it Andrei?
Well, it's Andriy, but if it's easier
Andrei.
for you, yes, Andriy.
No, I
Yeah.
can make I can make that work.
All right, great. Yeah.
Yeah, what's happening, man? Where are you calling from? What's your age? Tell me how I
Uh,
can help you.
okay. I'm 35. I'm calling from Canada at the moment. I had my MARPI installed when I was in Ukraine. It was in February, in the beginning of February, and I left Ukraine, and now I'm in Canada at the moment. And I have been turning my MARPI for quite some time, but I had problems. I think I'm at the moment I'm stuck at like 55 turns, I think, around that, 55, 60 turns. And I actually had a visit to Dr. Newaz in New York, and what he recommended to cut the arms of my Marpi because he thinks it's because of the arms. It doesn't allow for greater expansion, and he says that these arms should help if he cuts them off. And well, of course, I have several questions for you. And what would you recommend? Because at first he suggested that we can put another Marpi instead of the first one, put another one in. But I told him that, well, I don't know if I want another one in because this one gave me a lot of trouble itself. So to have another one installed is gonna, and the on the other side, like if I need any more expansion than that, right? Um, the one that I'm currently having, I think, like I'm not even sure how many turns I can still have, but I think it has at least 10 or 15 turns, so I could probably get up to 70 at least. I'm not sure because like the people who installed it in Ukraine, they didn't even know like the how many millimeters it can expand
Mm-hmm.
because at the moment when I had it installed, the orthodontist that was doing it, he only wanted to do very little expansion. But I myself wasn't up for that because I had a very little a tongue space in my mouth, and I wanted to maximize as much as I can in order for my tongue to have some room there so I can mew better and in general have a better life, better breathing and so on. And so at the moment I'm thinking, of course, I'm probably gonna go for what Dr. Newaz is saying and cut the arms off because I think that's gonna benefit the expansion itself. And also, I wanted to ask you if you know any specialists in Canada that are specialized in this kind of field.
Yeah, definitely, definitely. We can talk about providers in Canada. Why don't we take a look at what's happening inside your mouth first, just so I can have a better sense of what we're dealing with. Can you smile for me?
Yeah.
And those spaces between your teeth, are those diastemas from the expander?
Uh, what you mean, which ones? Which spaces? Because I actually had a big diastema, but now my teeth crooked in like this. My front teeth, they were like this, and but then they crooked in,
Mine did the
and
same
there's no
thing.
diastema at the moment.
Yeah, well, I see a little bit of space between this tooth and this tooth.
Yeah, that's
Yeah,
probably
right there.
the diastema from the expansion.
Okay. And
But I noticed that this part, the left side, is a little bit more, it has expanded more than the right side, so it's a little bit uneven.
can we see? Yeah. It seems okay, so at a glance it looks pretty even to me and it looks like you definitely have gotten wider. Can I see what
Yeah,
the roof of your mouth looks like?
yeah.
There it is. Uh-huh. Uh-huh. And so you want to expand more
Um, I
or
think I
you're
want to
not
expand.
sure or
I do, but not, I think, not to the extent that it's so wide, right? I think I want to expand until this application allows me to. This appliance, I mean.
you want to maximize this appliance and then maybe be done at that point.
I think so. Yes.
Okay. And did you see Dr. Newaz in New York?
Yes.
And will Dr. Newaz cut that appliance for you?
He actually he told me that we can cut it, but then like I said that the main reason I have a problem expanding more is because I think the plate itself is inside the palate, and but when I showed him the pictures I made like few days ago, because I twisted I think for 4 times and I went really slow as he said, but still it didn't cut it because I think when I had more expansion, when I was doing more expansion, the arms were cutting inside the flesh, and that's why it started hurting me.
Mm-hmm.
And so I showed him the pictures, and he said, "Yeah, we should cut the arms off because that's what's not getting the expansion going further because of it, because of the arms getting inside your flesh."
So when you turn the appliance, are you unable to turn it because it's like
I
too
am,
stiff?
I am, I am able to turn it, but it hurts.
It hurts because the arms are digging into the roof of your mouth.
Yes, exactly,
And
exactly.
have you gotten an infection or anything like that, or have you stopped it before that point?
I actually had an infection, I think 2 months ago.
Mm-hmm.
I was still in Europe at that time, and I had to go to a doctor, and they prescribed antibiotics for me, and then the infection went away. But this time, I didn't have an infection, but the body, like the part, the flesh, was very red because of the inflammation, and I turned it back down. I turned it back down, same 4 turns, and it got
Mm-hmm.
good again. I got started feeling okay.
And now you're stuck at that point. If you turn
Yeah,
again, it's just
because
going to inflame the gum, the
so I'm
skin.
not even bothering turning it again,
Yeah,
right? Because it's going to be the
right.
same thing. So I'm thinking maybe cutting the arms off is going to improve that, and I can keep going.
Mm-hmm. Mm-hmm. So
Yeah.
what's stopping you from just cutting those arms off now? Why don't you make an appointment with Dr. Nuaz, cut the arms
Oh,
off, and see?
nothing. But it's just not very comfortable for me to travel all the time to New York because I'm currently living in a province of New Brunswick. That's like
Mm-hmm.
the southern part of Canada. I mean, eastern part of Canada, and it's really far for me. So I was thinking, also beside other questions, to ask you if you know any other providers in Canada, like in Toronto maybe, or I don't know, Montreal or anything like that.
Yeah, we can look, but my sense is that it's going to be hard for you to find a Canadian doctor who's going to get involved with your treatment at this point and sort of take the handoff from the Ukrainian doctor. Dr. Nuaz is special in that Dr. Nuaz is willing to work with unorthodox patients like yourself. He's willing to get involved in the middle. He's willing to clean up a mess. He's willing to take on patients that other people wouldn't normally touch just because they're mid treatment doing something unorthodox. You could try.
Mm, okay. So
I
you're
can give
saying
you
that
some
like
names.
mid-treatment, people don't want to do mid-treatment, they don't want to get involved in that?
Oh, definitely not.
Mm, okay.
Yeah, it's
Okay.
very it's poison for a lot of these more conservative orthodontists.
I see.
Yeah.
I see.
Dr. Nuaz is exceptional in that way. That's why they call him the people's orthodontist, you know,
Okay. I actually
because
got him
he's
because I watched your videos and I actually you were tutored by him as well, right?
Correct.
At
Yeah,
some point, yeah. And so that's
correct.
why I chose him at this point and the point like previously. So I went to him and yeah. So I just wanted to get your opinion on the things that I'm dealing with. And also, he said that uh, like I don't have that much of a crookedness. I don't know. Can you see the what's it called? The
The
tilt or
can't,
whatever?
the
The cant?
can't. Yeah, smile. I see a little bit. Point to your left side. I see the left side is a little bit lower.
Yeah, yeah.
Is that right?
Yes, that's correct.
But it's very subtle. And I think maybe if you just lifted up a few of those teeth with like some Invisalign or something, you would get 50% better in that department. You do not have, it does not seem to be a skeletal cant. Like, did you see my interview with that guy, Ryan?
The one that had a very huge misplacement. Yeah, yeah, I saw that one. Yeah.
It's nothing like that.
Okay,
Okay.
okay.
Yours is way more subtle. And I think yours can be fixed with a little bit of orthodontics. Did Dr. Newaz also acknowledge that and say that that would be something? So did he say that he would take you on and that he would basically finish you off?
Yes,
He
he
did.
did. Yes. Yeah.
Out of his New York office?
Out of his New York office or his Vermont office.
Right. Yeah, he's kind of got several offices he works out of. I think he's got one in Florida too.
Yeah, yeah,
Um,
yeah. He got one in Florida as well. Yeah.
yeah, so
Yeah, he did. He said that he's gonna put the Invisalign, and because I live far away from his offices, he said that I would have like six of those Invisalign appliances, and which I would change every 2 weeks or 3 weeks,
mhm,
and that he said that it's gonna be everything's gonna be okay, and that it's gonna be able to fix my occlusion because now
mhm,
my occlusion is not okay, right? Because the upper one was expanded, and but the lower one needs to get expanded as well. But he said
mhm.
that by Invisalign we can the lower jaw and teeth like this, so it has a connection to the upper ones.
Correct. And at the same time, take the upper teeth and do them like this.
Yeah.
Yeah.
Yes.
And he's done that
Yes.
many, many times because he does a lot of MSE. He's very experienced in taking a bite like yours and finishing it off.
Yeah, I was thinking, okay, like ideally, it would probably be very ideal for me if my tongue would be able to fit in the palate. And I'm thinking if I remove the appliance, my tongue is gonna have more room, right?
Correct.
Because the appliance is in the place and it has gonna have more room. So I don't see at the moment, I don't see any need to put a second appliance in.
So I guess the question is, why did you do all of this in the first place, and have you achieved the goals that you wanted to achieve? Because if your goals are
Uh,
achieved, then you should not do anymore.
well, the first thing was my breathing,
Mm-hmm.
and the second thing was my tongue. Those
Okay.
were
And
the
how are
main
they now?
issues.
What was the issue, and then how does it feel now?
Well, it's way better for sure. It's way better. My breathing is better, and the tongue also is better. But I'm thinking that maybe there's still room for the tongue to get some space there. But maybe if I cut the arms and I keep turning, that's gonna be just perfectly like enough for me for the tongue to have the space in it.
Sure. Well, certainly first things first, right? Like, there's no need for you to predict what happens after you finish with this appliance. First, let's get through this appliance, let's see how you feel, and then you can make a decision at that point. Now, if you
Yeah.
want the most flexibility in terms of your options going forward, then Dr. Newaz is definitely going to be your guy. The Canadian orthodontists that I know of tend to be extremely conservative,
Okay.
meaning
Okay.
they probably wouldn't have even treated you to begin with unless you had some
Really?
severe malocclusion. That seems
Mm.
to be the way it is with the Canadian doctors, specifically with this one guy who I know of, who's up there. His name is Sylvain Chamberlain. Have you ever heard of him?
Oh no.
So he's very conservative with his skeletal expansion. So you seem kind of like a guy who has a vision for his own treatment and what you want it to look like, and you want some flexibility in terms of calling your own shots. Have I expanded enough? Do I want to expand a little more? Da da
Yeah.
da da da. You seem to be kind of like your own man. The Canadian
Yes.
doctors are not really gonna work well with that, from my experience.
Mm.
Dr.
Mm-hmm.
Newaz is going to be a lot more open to hearing your patient feedback and then make, trying to uh, meet your patient desires with his medical expertise. So
Okay.
if you tell him, I want to try 10 more turns, he's probably going to be like, okay, well, let me take a look. Can we make this happen? Okay, it's feasible. I can fix the teeth if he expands a little bit more. Let's do it. Whereas the Canadian doctors are going to be more like, well, your airway is da 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 cubic millimeters. There's no need for you to expand anymore. This is not clinically appropriate, so we won't do it. They're much more by the book.
Mm. Mm-hmm. Mm-hmm.
And by the way, they're probably not that much closer. So before we move on, why don't we just see about the Canadian providers that I have, and you tell me if it's better for you. You want to do that?
Sure, because I actually haven't looked that closely into Canadian ones because I'm not familiar with any one of them, right?
There's not many of them. And I don't think there's anyone in New Brunswick. So you're going to have to either travel to Quebec. Is Quebec the next
Okay.
closest state?
Yeah, Quebec is.
Is Quebec a lot, is like, for example, Quebec City or Montreal, is that a lot closer than New York?
Um,
Not
hmm,
really, right? Because you're
not
going
a
to,
lot.
where are you, Nova Scotia?
No, New Brunswick, Fredericton.
Okay. Is Nova Scotia its own province?
Yes, Nova Scotia, its own province, yes.
Okay. So could you drive to, like, are you driving to New York or are you
The
flying?
thing is, I don't have a car at the moment, so that's why I'm not even able to drive. So, of course, like I'm not even looking from this perspective of what's closer, but from the perspective what's better for me.
Yeah.
What's better and who has more experience and whose end result is gonna be the most beneficial one. So, if you're saying that Dr. Newaz is a good choice to go with because you also worked with him and you know what he's able to do. So yeah, I'm okay with that because I wanted to get a second opinion, and yours is very valuable to me.
If you're just looking for someone to give you the best possible care, I would stick with Dr. Newaz.
Okay.
I would
Yes.
not
Great.
change horses midstream.
Okay. Okay.
Okay. I think Dr. Newaz is going to, I know for a fact that he's been dealing with cases like yours for 3 to 4 years now. Um, he's reasonably close to you, right? New York.
Yeah. Yeah. Yeah.
You've already seen him. He's already treated you to a degree. He's consulted with you. He
Yes.
has a plan for you. His plan makes sense. He's giving you
Yes.
options, meaning,
Yeah.
okay,
Like
if
the only thing I probably was wondering, why would he give me an option of another Marpi or an MSC? Like because when I watched your episode with Ryan, and I was like, oh man, like second one is probably too much, but I don't know, maybe not in all cases, but
yeah, so I don't know. I don't, and I'm certainly not saying that that's what you should do, right? Um, and if you do a second Marpy, it doesn't have to be a lot. Like you could even do a second Marpy just for another millimeter or two just to get you right. Um,
mm-hmm.
but I think the point with Dr. Newaz is that he's kind of more, he's open minded, he's flexible, and that he's not gonna impose artificial restrictions on what's possible for your treatment for out of fear of like violating some textbook protocol. He's uh, a lot more flexible in that way, but in a controlled
Okay.
and careful way. Okay,
Mm.
because he's been doing
Okay.
this for so long.
Yes.
Um,
Yes.
he has a lot of power, but he also has a lot of responsibility with that power, because he has the experience to back it up.
Yeah.
So,
Yes,
um,
definitely.
and he didn't say that you're definitely gonna do the second Marpy, right? He just said it's possible that that could be an option.
Well, he told me like we can go with the second one. I said, oh, you know what? Because I had so much trouble with this one because of all these inflammation that I was having because of the arms or anything that was getting into the palate. I was like, oh, I don't think I want another hustle of was with another one. So he's like,
Sure,
oh, it's okay. I think we can go with this one and maximize this one, and maybe that's going to be enough, and there's no need for a second one. And I was like,
right,
yes. Like,
right.
did you ever have any trouble with that when you were, because maybe you had a different one, because I have a Marpe and you had an MSC, and I'm not sure if it has the same kind of arms and all of these uh, additionals to the appliance itself. Did you have
Mm,
any issues with that when you had yours?
I had one screw on my MSE get inflamed and painful, but I never had any issues with the arms of the MSE cutting into my skin or anything like that. But I know many people who have. It's very common.
Hmm. Hmm. I
And
guess it's very individual or something like that.
well, MSE is very unpredictable and very chaotic, and the appliance does different things in different people's mouths. Sometimes the screws split perfect and the screws remain fully intact, and then you keep turning it and it keeps spreading perfectly even without putting any stress on the arms. It's all in the bone in a perfect scenario. Sometimes that happens, but in other cases, the appliance really struggles to split the suture, and then it bends and it warps, and then sometimes it starts to drag through the bone and it starts to put all the force into the arms, into the teeth, and into the skin, and then you start getting pressure being put in places where it's not supposed to be put, and it's all very individual. I mean, the only
Yeah,
way that
yeah.
you can really prevent some of this more chaotic complications with MSE is to do the surgical assist, to go to sleep and wake up from the surgery with a suture split and the appliance perfectly intact, and then you know that the appliance is just gonna it's going to be clean, smooth sailing for the appliance at that point because the hard work is already done. And now the appliance is just spreading things apart without having to actually split anything and get warped and fucked up in the process. You know what I
Yeah,
mean?
yeah. Well, you know
So,
what I had, my experience with because I also had a surgical assist with my MARPI, but it wasn't like the one you were talking about. They actually cut cut the skin first, and then they used, I don't know, some sort of a saw or something like that, and they cut a little bit of the bone itself. So when the expansion started, it would be very like way easier for the suture to split. So they actually cut the suture a little bit, right? And it was very uncomfortable actually, but like it's okay, it's no problem with me because I wanted for that to happen. And yeah, that experience was a bit uncomfortable, but what can you do? Like if you want something, you got to deal with it.
well, bro, I mean, to be honest, it looks like it turned out well for you because,
Oh, it did. Definitely.
like,
Definitely.
your split seems pretty even to me.
Yeah,
Like, I'm not
it is.
seeing any asymmetry in your face. I'm not even seeing any real asymmetry in your bite. I'm seeing
Do you
that
see any asymmetry like right here where my nose is?
there's a little asymmetry in your nose, but is was that pre-existing?
I don't think so. I'm not sure because I actually had a trauma here. I had a crack of this bone,
Hmm.
um, like more than 10 years ago. And I'm assuming that maybe that also has an effect on the expansion itself, that maybe the left side went expanded a little bit more, slightly more than the right side. But it's just maybe not, but it could have an effect, right?
I mean, your left nostril, now that you pointed out, does look significantly wider.
Yeah.
Lean your head back a little bit like this. Okay, from that angle, I don't really see it.
Hmm.
Stay there for another second. From there, I don't see it as much. And then let me see your smile one more time. I don't see it, man. It seems even to me.
Well, that's good because when you can see this is uneven right here, right?
The
Where the
midline is a
middle
little bit
of,
off. Yeah.
yeah, yeah, a little bit, yeah.
Yeah, that probably has to do with the way your upper front teeth reacted to the diastema. They just sort
Mm,
of floated and wandered.
yeah, yeah. I wonder what that's. I don't think that's gonna have that bad of an effect on my teeth because my upper teeth went like this, right? Or like this.
Mm-hmm. Right.
This is like the bottom of the teeth, and they went like this because when they split, they went like this, and now they went like this.
Mm-hmm.
I'm not
Mm-hmm.
sure if that's gonna have any negative effect on the teeth or anything in particular, like the bite or anything like that.
No, that'll all get resolved in the orthodontic part of your treatment.
Hmm.
That'll
Okay.
be that'll be taken care of next. As soon as the MSE situation is resolved, as soon as you decide, okay, I'm done expanding, then all of that tooth stuff is going to get packaged into an orthodontic treatment that gets presented to you by Dr. Newaz or whoever else. And as soon as you get your Invisalign trays, it's all going to start getting better right away.
Yeah. Yeah.
Those upper front teeth will get uprighted, they'll get straightened out, and then they'll get pinched together to close that diastema right along that midline, ideally.
Yeah. Uh. Well. Okay. Okay. That's good to have your opinion on all these things because it's just kind of hard for me, to make decisions on these different things. And the thing is, I don't have the means to travel that much to all of the other providers, right, in the US, even the ones that you have mentioned. Um, and you're getting your treatment with another doctor, right?
Correct. Yeah, that's right.
Why did you stop your treatment with Dr. Newaz?
So I, during COVID, um, there was a perfect storm of events that caused me to stop traveling to New York. So my father
Hmm.
got really sick, and I'm living with him and taking care of him. And then New York got really sketchy with COVID. And then
Okay.
those things together, and my family and I were just like, you know what? I don't want to go to New York anymore once a month. It's just too much of a hassle and too much of a sketchy situation going into that city, through the pandemic, basically.
Hmm. Hmm.
And so I found someone local that was like within, really close to my house. And then him and Dr. Newaz worked together. Actually, Dr. Newaz referred me to him. He's a friend of Dr.
Okay.
Newaz. So the office that Dr. Newaz works at in Vermont is the office of the daughter of the orthodontist that I started seeing locally.
Okay.
So his name
I
is Dr.
got you.
Walker, and
Dr. Walker.
he's an orthodontist in Massachusetts, and then his daughter is also an orthodontist who's super airway focused, like Dr. Newaz, and she's in Vermont. So
Hmm.
Dr. Newaz was still part of my team. It's just that I was being seen locally, not going to New York City anymore. But then after a year of that, truthfully, I just wanted lingual braces. Like, I wanted my braces to be invisible. I just couldn't do the
Hmm.
braces anymore, man. Like, you get to a point after fucking 5 years with metal in your mouth as a 32-year-old man where you're just like, enough is enough. I've got
Yeah. Yeah.
another year or two of this because my teeth were so banged up. And I wanted lingual braces. I wanted braces on the inside of my teeth. So at the end of 2021, actually in the beginning of 2022, actually just like 6 months ago, um, I have another friend, Dr. Lipkin, who I know through the whole JawHacks airway orthodontics community. And he told me he had a product that he uses called BRIUS, which is a lingual braces system. And he offered it to me, and now he's treating me with that lingual braces system. So I have braces on the inside of my teeth. So it allows me to look normal, but actually I have a ton of orthodontic work happening on my mouth as we speak. It's just all
Mm-hmm.
hidden.
I understand. So what is like the difference between Invisalign and the braces, the one that you are using?
The system I'm using is just totally invisible. The thing about Invisalign is that it's not that invisible because they put those brackets on your teeth. They call them
Yeah.
the not brackets. They call them the attachments. So
Okay.
basically, even with Invisalign, you have to put these little knobs on your teeth that serve as lever arms for the Invisalign trays, and they're actually super ugly looking. If you ask me, I had it. Um,
Mm-hmm.
so it's like with braces, at least when you smile, people see the braces, they're like, "Oh, fucking, he has braces," like
Yeah.
whatever. But with the Invisalign, you just have these weird, uh, uh, enamel colored blobs coming off of your teeth, and you smile and it looks funny, but no one really knows what's going on. They just know
Yeah.
that there's something off about your teeth, and I just don't think it looks great. So
Okay.
I didn't want that. I wanted something truly invisible.
So would you recommend like because I don't want I don't want something that's not gonna look nice because first of all I'm a singer actually and for that for me it's very important right to for my smile to look good and my teeth and that's why I would probably want to find out like do you think I can get the braces the ones you're having and put them instead of Invisalign?
So if you told me you were anything but a singer, I would say yes. But the problem with what I have is that it makes talking suck because they're
Oh,
on the
yeah,
inside of your teeth. So you're literally
yeah,
changing the whole mechanism of how your tongue works with the inside of your mouth and your teeth to create sounds.
yeah,
So
yeah,
I'm a little bit better now, but my speech is actually really hard. And you can
yeah. I
notice
can
that when
hear
I
that. Yeah, I
talk,
can hear that.
I kind of have to lower my lower jaw to like put my tongue in position to avoid hitting the brackets on the inside of my teeth. I mean, look, dude,
Yeah.
look at what I have on my mouth.
You know what? Actually, like the quality of your video is not really good, so I'm not able to see it properly.
Okay. Yeah, that's unfortunate, but basically, man, can you see this?
A little bit, yeah, because you're very
So,
blurry for some reason. I
just
don't know why.
just imagine on the inside of your teeth you had braces and
Yeah, I understand.
how much of a bitch that would be when it comes to talking. So I actually don't recommend that to you because you're going to have this system on your mouth for probably 1 to 2 years.
Whoa, that's a long
So
time.
I would recommend for you either braces or Invisalign because with Invisalign, if you're performing, you can just take the tray out.
Okay, okay. Yeah, that's a
Yeah.
good
The
point.
one the
That's a
one
good
big
point.
downside of the BRIUS system that I have is the effect it has on speech.
Yeah. Well, it's not that, as you said, if I wasn't a singer or anyone who like, I don't know, does professionally with their speech or singing, that wouldn't mean much, I guess.
I mean, in a way I'm a professional speaker, right? Like I have this YouTube channel where I talk a lot. For better or for worse, maybe I should talk a little bit less, but I mean, when I started up my YouTube channel back in May, I was like, fuck man, like do I even want to do this right now or should I wait till these braces are out because I really sound pretty funny. Like is this
Oh
really a
man,
good
don't worry
idea?
about
But
it. It doesn't even actually matter because the most important thing is what you're bringing, what you're saying, what you're giving to people.
for sure.
So that's nothing you have to worry about, that's for sure.
Thank you, man. I really appreciate
Yeah.
you saying that. You
Yeah, and I
know,
wanted, to say that you're probably inspiration for many people to do things, to learn. You've been giving so much information to all of us, and just want to say thank you that what you were doing. Well, at
thank
least
you,
from
man.
from myself. You're making a big impact in this field, definitely.
Thank you, man. That means a lot.
Yeah.
I was just listening to a podcast this morning with Joe Rogan and Andrew Huberman. And Andrew Huberman, he's a neuroscientist, and he was talking about the benefit of gratitude practice. And he said, actually, the most beneficial gratitude practice is not you being grateful, it's other people expressing gratitude to you. So it's actually receiving gratitude has the best neurochemical effect on you. So
Mm.
uh, thank you for giving me that benefit.
Well, that's great, and I didn't have the scientific arguments on that, but you just told me that, so
Hell yeah, man.
that's great. That's great. Well, what else can I still ask you or we can talk about? I see we can still have like 20 minutes left. Um, Anything? Probably because I've discussed most of the things that I was going to ask you.
Yeah, take your
Um,
time, man. Take your time. You know,
yeah.
it sounds like what you really wanted to get out of this call was a plan. Um, it sounds like you're kind of, I mean, without assuming too much, are you new to North America? Did you recently come here and this is like an
I
unexpected
actually,
situation?
no, actually, I lived in Canada for about like 6, 7 years because I came to Canada when I was 11, and I graduated from high school, and then I left Canada and I went to study singing. I studied singing in Ukraine, and but now, like I came to Canada. I was coming to Canada for a few times before now, but like I haven't been living in Canada for many years since then. But yeah, in the situation that's currently in Ukraine, that's like it forced me and my family to move out, and yeah, so I came here and I'm living here right now,
Good,
living in
man. Well,
Canada right now, and
I'm glad you're in a safe place with with a situation that you can use as a launch pad to kind of finish off your orthodontics and get your health right. And you definitely are in
yeah,
that position, especially if you have access to come to the U.S. And to be able to see Dr. Newaz. To me, that seems like a perfect situation for you.
yeah. Well, that's probably what I wanted to hear. You know how you want to have a second opinion and you want to be like, okay, this is a good choice, and I'm gonna go with it. And yeah, and hearing it from you, it makes me more confident in what I should pursue next.
hmm I think the big
What I should
decision for
pursue
you is going to
next.
be knowing when to stop with the expansion. Uh, be content with the gains that you've got, which to my eye look very significant. It looks like you have a significant amount of expansion, and that even if you stopped now, that would be okay. Especially because I'm already hearing you say that you have fear that there might be an asymmetry forming on that the left side, and
Yeah, I
so
hear.
like this has been the theme of my channel really for like the past month is like the sweet spot with MSE is moderate expansion. MSE is great as long as you don't overdo it, especially into an asymmetry. Actually, the chat
Yeah.
that I had just before this one was another asymmetry case and another person who felt like they went too far with their MSE.
Mm.
Okay, and they basically cautioned the audience like, hey, look, if you're doing this MSE, take it easy, take it slow, don't overdo it. And she actually, what her question was for me is, how do I turn it back to make it smaller? And I said, honey, like it was a female. There's nothing you can really do. Like you can't. First of all, the MSE was already out of her mouth. Second of all, it was already fused up because it had been like 6 months.
Okay.
You can't go backwards, bro.
Hmm.
Especially after it fuses up. So what I'm hearing from you is caution, and let me just be here to say you are right to feel cautious, and that you should take your winnings and walk. Don't be afraid to
Yes.
take your winnings and walk. There's a temptation with MSE to get while the getting's good. More is more. But
Yeah.
too much of a good thing is too much of a good thing. It is. So and you can't always count on the doctor to know what that point is. Okay? Really, you have to know what that point is. And you're going to know your own mouth and your own asymmetries in your own airway better than anyone else is going to know them because you're on the inside of it.
Yes.
And so, um, I mean, we see it over and over again. Doctors missing the excess MSE expansion. And I hope maybe I can serve as like a second opinion for people who aren't sure. And I can just say, man, like, be careful and don't be afraid to pull the plug and be done with the expansion and move on to the orthodontic phase, being content with what you have.
Mm-hmm. Mm-hmm. Yes, that's a really good point. That's actually you were correct that I'm cautious about it, and I want to get, as I said, the best result out of it for myself.
Hmm.
In all cases, like aesthetically, but first of all, breathe wise and tone wise. And I'm thinking that if I continue with this appliance, um, like well, I'll see how it's gonna go when I cut the arms off. I'm gonna see how it's gonna go. If I'm gonna see that it's going well, and I'll probably keep turning and finish this appliance, and then I'll be done with it. Because I'm pretty sure that I'll be more than happy with what I'll have in the end result with just one appliance, this one.
Hmm.
Yeah.
Yeah, you feel like you're close. You feel like, okay, maybe a little bit more. Your appliance has a little bit more life left in it. And you're
Yeah, I
thinking,
know it does because I already did more, but I had to turn it down again, right?
right, yeah,
Yeah.
that
And
sounds
I'm
like a
feeling the
perfect plan.
difference, and I'm feeling the difference. So when I turn a little bit more, I'm feeling the difference that it's widens a bit there. I have a little bit more space for the tongue, but because of what I said, I had some trouble with the arms and all of that digging in. So hopefully that's gonna work, and yeah, and that's a plan. That's a plan, and I'm glad that I've discussed this with you. Now I'm more confident in what I can do next.
Hmm.
What
Yeah,
I can do next.
yeah, that's good. Cut those arms off and then see if that gives you, if that relieves the issue with the gums getting irritated.
Yeah,
You know,
yeah,
because if you need a second MSE, that's going to add like at least 6 months to your treatment because you're going to have to wait a couple months to get so you're going to have to remove the MSE you have now, or maybe even wait a little bit to keep it in as a retainer for a couple months. Then you're going to have to remove it. Then you're going to have to wait for the holes to heal up and for the bone to heal. And then you're going to have to order a new appliance. You're going to have to come to the US to get a scan and da 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 da. It's going to add maybe like 6 months to your treatment just to get that second MSE for a couple of millimeters. So
yes, yes. And of course, like it's not that easy to do all these treatments for such a long time, right? You probably know better than anyone else that it's, oh man, it gets so like, ah, fuck it, I don't want this anymore in my mouth, and I just want to be done with it. And yeah, and it's more efficiently. It's to do it more efficiently, like, and to have the result, and but not do it for like 10 years, you know?
I do, man. You're right. I do know better than anyone. I've had metal in my mouth since June 2016.
Yeah, it's like
So
6 years now.
yeah, which is crazy, especially
It's
considering I have
crazy.
at least another year to go.
Yeah.
So
But like you're within a year, you're supposed to have everything done, right?
pretty much, yeah. So in my case, it's basically just orthodontics at this point, trying to get my bite right. I know you can't see super well because the video is blurry, but I still have some gaps here,
Okay. Yeah.
and they're getting a lot better. And in the past 3 months, with the TAD system that Dr. Lipkin has on the roof of my mouth, closing those gaps, it's been super effective. But it moves so slow, man. So probably another 2 months closing that. And then Dr. Lipkin said he's going to be ordering a new BRIUS wire for the upper and the lower. Normally, a patient only needs one BRIUS wire, like legit. They just put this one wire in, it's pre programmed, and then your whole orthodontic treatment is just that one wire. Um, going back to its original form and taking your teeth with it, essentially. It's kind of like 25 Invisalign trays packed into one wire. I'm going to need a second wire. And then once that second wire is finished, that's probably going to be it for me, man. So, yeah, probably like 12 months, I would say. 1 year, and I'll be finito.
Finito, yeah. That's good. That's good. Um, what do you think, like, can, as up, you probably heard this question many times, but do you think that mewing can actually, within time, help to grow your faith a little bit forward?
So, for a guy like me or you who's in their 30s, I think in terms of mewing having an effect on bones, you need to think about it in 5 year chunks, not
Mm-hmm.
less.
Mm-hmm.
All right. So, I think the way your face would look in 5 years, like let's say in 2027, if you mew, would be different than your face would look in 2027 if you didn't mew.
Yeah.
But I think if we're being real in terms of bone changes, you have to look at it in 5 year chunks for adult men. But that doesn't mean, oh, mewing is pointless. I shouldn't mew because it's not going to have any effect, unless we look at it in the super long term. No, not at all. Mewing is still important for soft tissue and for posture and for breathing and for a million other things. So you specifically asked, what effect will mewing have on growing my face forward? And that's bone, right? We're talking about it moving the maxilla forward, slow over the long term, but immediately mewing will give you results in other areas. It'll make your tongue stronger so that you can put your tongue up on the roof of your mouth so that you can breathe better through your nose. It'll help shape the muscles of your face to give you a better looking soft tissue in your face. Okay, it helps you with your full body posture because keeping your tongue pressed up on the roof of your mouth sets the foundation to have good neck posture and therefore good posture throughout your whole body. Mewing gives you strength when you're doing certain heavy exercises, especially neck exercises, um, headstands, and if you're hitting a heavy bag, you want to keep your tongue pressed up on the roof of your mouth. Any intensive activity, you're going to want to be mewing, and that just gives you so much more strength. And it's really an infinite number of positive benefits you get from mewing because mewing is, of course, just natural posture. Mewing is just how you're naturally supposed to hold your tongue and your lips and your face and your chewing. That's all mewing is. It's correct primal posture of the face, of the mouth, of the tongue, of the lips. And so we should always be mewing, but in terms of effects on the bone, for men like us in our 30s or older, you have to look super long term at it.
Yeah. Yeah. Because, like, from my own feelings inside my mouth, like, I feel that my tongue does not only have not enough space, like palate wise, but uh, in this way, like
Front,
forward
back.
wise, right? Like it feels like my tongue wants to get out in front of my teeth like this, and it's the most comfortable position for the tongue. Yeah, but I don't want to go for these double jaw surgeries just because of this. I don't know. I think it's just too much. Just
People are
because I
doing
have.
that, man. People are going for double jaw surgery just because they feel like their tongue should be farther forward. Can you step
Mm,
back so I can see what you look like from the side?
yeah,
Step back like maybe 6 feet. Yeah.
like this.
Yeah, that's fine. Yeah, man. You know, I think you're okay. Like I don't think you should like be planning double jaw surgery necessarily into your future. Yeah, I mean, you're not perfect, but no one is. And you don't strike me necessarily as a candidate for double jaw surgery.
Mm.
You
Yeah,
know,
like what I'm feeling is just maybe a few millimeters, right? Like maybe a few millimeters forward, like my lower jaw, because I feel as though I have a little recessed lower jaw.
Yeah.
But I don't think that's gonna be that of a effect on my life.
Truthfully, every person I talk to, including myself, feels that way. We all want a little bit more forward expansion. We're all
Mm,
frustrated because there's this MSE appliance that gives us, you know, 6 millimeters of transverse expansion, but then our front back stays the same. And that ends up becoming our weak link, is our ability of our tongue to come forward. And it's incredibly frustrating. Unfortunately, the only real option is double jaw surgery, unless you want to start messing with tipping your teeth, which you don't, because you don't want to have your front teeth like this, like they do with the AGA. It's not a
yeah.
good look and it's not healthy. It's very destructive to your teeth. So,
Yes.
I mean, I can tell you how I'm coping with that. It's just like you either have to accept a little bit of imperfection and move on, or you have to get double jaw surgery.
Yeah. Yeah. It's a
And
choice we all have to make.
coming to terms with double jaw surgery is one thing. Like, I personally don't think it's as bad as people make it out. I think, okay, it sucks for a month. It is a trauma. It's a surgery, but the mouth heals incredibly well. The mouth heals incredibly well, and it's funny. On that same podcast I was just telling you about with Joe Rogan and Andrew Huberman, Huberman was talking about how right now scientists are so curious about why the mouth heals so quickly. Like, you know how if you get a cut in your mouth, it heals in like a day, right? Like if you ever
Yeah.
bite your lip, and then
Yeah.
it fucking hurts, and then it's bleeding, but then the next day it's like it never happened, right?
Because of saliva, maybe, no?
Well, they mentioned that there's something about the environment of the mouth that helps it heal incredibly fast, faster than any other part of the body.
Hmm.
All right, and I think that's relevant to like all this stuff that we're talking about, like especially the double jaw surgery. You can wreak havoc on your mouth. You can cut the bones, you can cut the gums. It's gonna heal. I mean, they've been doing this shit since the 70s, right? Breaking the jaws, moving them forward, plating them there, da da da. They've been doing that for decades. Like, we know that it works. We know that you will heal eventually. Yeah, you're going to get swollen. Yeah, it's going to hurt. Yeah, you're going to have a liquid diet. But it's not the end of the world. Like, it will heal. And in fact, the mouth heals better than any other part of the body. So, the one caveat to that is that the teeth do not heal well. So,
Mm.
I thought about leaving a comment under the video. Well, actually, I don't even think you can leave comments on Spotify. But if I could have left a comment, I would have been like, Dr. Huberman, Joe Rogan, yes, the mouth heals fast, except for the teeth. If you fuck up your teeth, like through an appliance, an oral appliance like AGA, that just pushes on the teeth, that does not ever heal. Once your teeth go down a path of destruction, they do not come back. It's a one-way path. You cannot really restore alveolar bone once you
Yeah.
have that resorbed through an oral appliance like AGA or some other expander. That's why I'm telling you, like, I didn't say, all right, Andriy, you have a few options. You have do nothing, you have double jaw surgery, or you can get an expander to push your teeth forward and get you a couple of millimeters that way. I did not say that because I do not think that's a good option. Leave your teeth alone, because once they
Of
get fucked
course.
up, they stay messed up for forever after that. I know that because mine are like that.
Yeah.
And in fact, the reason that I probably can't even do double jaw surgery, even if I wanted to, is because my teeth are too damaged. And like
Oh,
when you cut this bone, because when they do double jaw surgery, they cut that bone and then they move it forward.
yeah.
Like, it does have an effect on the teeth because the teeth get cut off from the blood supply temporarily. And my teeth are so damaged that, like, it's not even clear that if I did that, would my teeth survive that.
Mm-hmm.
So it's an
Mm-hmm.
added complication that I personally have that might make it impossible for me to do double jaw surgery even if I wanted to. Not that I do want to, but even if
Okay.
I did want to, it's a factor.
But like at the moment, you're feeling you're okay without it, right?
I'm not perfect. I definitely feel like I could enjoy, a half centimeter of forward expansion,
Yeah,
maybe a whole centimeter. I mean, don't we all, right? Like,
of course.
you know, but I'm functional. My headaches are way better. My athleticism is much improved. My sleep is solid. I look fine. I have a girlfriend anyway. I'm not trying to impress anyone at the moment, right? And hopefully I will
Mm.
never will have to again. Hopefully she's my last girlfriend. All right. And babe, if you're listening, hi. Sometimes she listens.
Yeah.
But like, yeah, I'm good, bro. I'm good. The perfect is the enemy of the good, right?
Yes, definitely. Definitely.
Especially when you've been doing this shit for fucking 5 years like me or 6 years or whatever. Like at some point you just gotta take your winnings and walk away from the table.
Yeah, and stop all the improvement ideal bullshit, you know?
Yeah, exactly.
Like you can't be perfect. No one is and never will be.
100%.
Yes, yes.
100%.
Great, great. Well, I think I've asked all the questions I wanted.
Good deal, bro.
Yeah, it was a great talk. Thank you so much. Thank you for your knowledge, for the help.
Yeah, you're
Yeah.
very welcome. And I think you're in good hands. You've got a good plan going forward. And yeah, if you want to reach out to me, feel free, and I'm happy to help you along the way. Okay, but you'll be in great
Okay.
hands with Dr. Newaz.
Okay, great. Great.
All right,
That's
Andrei.
great to hear. Okay, have yourself a great day and thanks a lot again.
Okay, you're very welcome, and thank you.
All the best.